I thank my friend from Texas. Mr. Speaker, I rise today in support of my bill, H.R. 1192, the National Critical Care Commission Act, a bipartisan bill which is co-sponsored by over half of my House colleagues. It has this level of support because this nation faces an epidemic. Diabetes, or pre-diabetes, affects over 100 million Americans. Nearly 1 in 3 of our neighbors are affected. Dr. Phil has diabetes. We met. He's a strong proponent of this bill. This is in addition to all of the other Americans who have diseases that fall under complex metabolic, autoimmune, or insulin-resistant diseases. When I first came to Congress in 2009, it was crystal clear that we had a big problem. The benefits of all this federal research dollars going into these diseases were simply not making their way to patients. The researchers at the NIH, the CDC, and even the EPA weren't sharing diabetes research. It was clear to me in 2009, and it's clear to me in 2016. We need a laser-like focus on improving patient care by pursuing a strong federal focus on research. My bill accomplishes that goal through the establishment of a National Clinical Care Commission made up of doctors with specialties such as endocrinologists and other healthcare providers who work directly with patients and pharmacists. This commission will have 3 years to strengthen a partnership between federal stakeholders and health professionals who will bring hands-on clinical experience to improve care. This is not a new, unending bureaucracy. After 3 years, this commission will sunset. In 3 years, it will be gone. We've made a huge investment of taxpayer dollars in research. It's to leverage that investment and translate that into meaningful prevention and effective treatment options. So today, on World Diabetes Day, I ask my colleagues to vote for H.R. 1192 and help all those who suffer from diabetes and other complex metabolic and autoimmune disorders. I thank you, and I yield back.
The gentleman yields back. The gentleman